One quick point to follow up on what you was asking. In HR 3400, they expand the high-risk pool for people in special situations and people who can't get coverage today. They expand the whole high-risk pool concept. So I can't give you specific numbers, but they do address it by making it possible for everybody to be able to get some sort of coverage, even in the situation where today they can't get covered in this sort of thing.
You have a question?
I'd like to just make a quick comment of the gentleman. Mr. Kane, thank you for being here. Thank you for giving us the time. My name is Luke Damianov, and I will give you a very straightforward example of what the doctor just said. I'm originally from Bulgaria, and I was blessed to have the opportunity to come to the United States in 1999. And to see the health system here and to kind of have a clear understanding where I'm coming from in Bulgaria, a socialist country with years of communism, dictatorship, etc., it just blowing my mind away because I lost 2 parents in a window of almost a year and a half because of exactly what the doctor gave a good example, because everything is run by the governments over there. The healthcare was just not stimulated by the way it should be. So my poor parents didn't have access the way they needed to have. I had to go and accommodate just a flight to a $2,000 flight to go to Bulgaria, and I was powerless. I could do anything because of the rules and regulations I had to go through. So I can't express how humble guys you are, and I admire all of you for what you are doing and what you're trying to prevent. And I listen to your show, Mr. Kane, every single day. I'm 35 years of age. I'm from Bulgaria. I'm so humble what is going on with that country. I got my citizenship in 2007, and I'm like, I can't believe how people can take such a country and healthcare for granted. I mean, you guys don't know what you have here. I mean, you don't know what you have.
Some of us know what we have.
It is. I mean, my body right now is shaking, and my heart is pumping like crazy, and I'm like, why you guys don't wake up? Wake up, understand what is going on with our health system.
You know, we are waking up.
I hope so.
And all of these people are going to go out and talk to all of their friends and so on and so on. And I can tell you, and Brian will tell you this as well, I'm sure Mr. Kane, I have seen in the last year a tremendous change in people's perspective, and the facts are getting out there, and we are going to change this. And that's why I keep coming out to do this. You know, the first time I did it was at the VA with 4 old guys that already agreed with me, and it was 3 hours away. And I thought to myself, what a waste of time. And, you know, now I'm optimistic that things are going to change.
Give that man a hand.
Yeah, no, amen.
We have to change control of Congress in November. The longer it goes, when people find out what's in it, the more informed people become, the better chance we have to build public support for repeal. It's just that simple. That's why it is so critical. That's not a partisan political statement. It's just a fact. If we are ever going to be able to try to repeal this legislation, this is the worst piece of legislation we've ever passed. When Medicare was passed in 1965, on the surface, it wasn't what we have today. It was nowhere near what this legislation represents. Go ahead, sir.
So if we're able to repeal or effectively amend the current legislation, where do we go to? And I'd like the panel to comment on what you consider the 3 greatest violations or issues with that would call what I'd put under insurance reform, and what are they, and what would you do about them? Because it's real easy to say what we now have doesn't work. We said what we had before the current bill wasn't working. And now we went down a path that I think is becoming clearer by the day is not the right solution. So where do we go as we get there? And one of our big challenges is, though, I think it is, you've said earlier, this is not about, it shouldn't be a party issue. Unfortunately, it's very much a party issue.
But it's time for us to stop accepting that statement right there, to be honest with you. And that's what kind of starts getting under my skin, because I hear that from everybody. And why do we accept that we allow our politicians to make this a party issue? And the only reason that they come out and make it a party issue and say it's a party issue and an ideologic issue is because we sit back and say that and let them keep on going down this path. And that's where we've got to start holding our politicians to the fire. Whether, to be honest with you, there's a tsunami in November and the Republicans take over, you know what? Their feet need to be held to the fire just as much as the Democrats' feet need to be held to the fire. Because that's the problem, is that we're letting it become politics as usual because we let it become politics as usual.
I'll tell you too, there are more and more of us, you know, one of the first things that happened to me when I got involved with this was I make a statement and immediately I'm a racist or a radical. And I work in a hospital that, let's say, has a lot of employees that don't necessarily agree with me politically. But I've gotten to a point where I'm afraid enough that I'm willing to risk being called a racist, and I proselytize all day long in my operating room. And I've seen over the last year people start to come up to me to ask me more questions that I thought I never would have a chance of convincing otherwise. And so that's what we need to do. We need to talk about the facts. And I've said on the radio when I've been called a racist is, you've got to be kidding me. That's the only comeback you can give me for this debate. We need to start talking about facts. And if you want to make the argument that government-run healthcare is the way to go, you need to show me one statistic, one fact, one place where it's been effective to get me to listen. But until you can do that, every single fact, statistic, piece of evidence tells us that that is not the way to go. And we need to have the courage to stand up and tell everybody, look, if you vote for it, and look, again, I'm with Brian. The Republicans have been no friends to healthcare over the years, and neither have the Democrats. But it has gotten to the point now where if you vote for a Democrat in November, you are essentially condemning us to becoming a socialized nation. And healthcare is the last linchpin in that road. And it's now or never. I mean, it's that important.
But on my website, I have my commentaries. I summarize what's in HR 3400. It's worth the read, I'm telling you, because people don't know. There are no mandates. It's 10 points to summarize how we can make healthcare better in America. And it's basically a summary of what's in HR 3400. I recommend that you read that if you don't read the whole legislation. It has the kind of concepts in there that you're talking about. But because a lot of people are never going to read that, they're never going to hear that information, they think that the only solution is the government solution. Dr. Davidson, you have something to say.
Well, a couple things. I would agree the challenge really is it's easy to be critical. It's hard to come up with programs. But I think as a basic concept, everyone has a place in this debate and this argument. We're all, at some point in our lives or our families, are in need of health care. And we've got to make the incentives in the right direction. There shouldn't be incentives to overconsume. There shouldn't be incentives to overprescribe or over-procedure. The government isn't an answer. I was assistant chief of surgery at the VA here when I first came to Atlanta. I was on the Emory faculty for 10 years. And I will tell you that it is a pretty good agency, but it's not efficient by design, and there isn't an incentive for it to be efficient. And I think that's the key. People have to have an investment in their own health. Somebody wrote a good article 4 or 5 years ago, and said something that hasn't been emphasized enough. If we can't get the public to buy into the concept of public health, which all of us here, all of you obviously do because you came out for this event, but if we can't succeed in getting everyone in our society buying into controlling and doing what they can do for their own health, we will never control healthcare cost ever. And I think if the expectation is I can drink and I can smoke and I can drive my car into a tree and somebody's going to patch me up, that will never solve the problems. We've got to make sure that the incentives are aligned. We're an incentive-based society. If the incentive is to consume more, to do more, that's what people will do. They're human, and even if with the best intentions often, they will not make a correct choice.